Okay, Ming, it's fine. I'll see you in my office in a couple of minutes, okay?
That's over. I think I did okay, but I was really nervous, especially when it came to inserting the needle.
She did fairly well overall, safe and reasonably effective. Obviously very nervous. I think my presence didn't help there. Skin prep and drapes, okay. Local anaesthetic technique, not the best, didn't allow enough time for it to work. Incision okay, and inserting the needle not too bad. One problem was she ignored the patient almost all of the time. Need to talk to her about that. Come on in, Ming. Take a seat. One tea with a touch of milk.
Lovely, thank you.
Okay, you right?
Yes.
How do you think it went?
Okay. I was very nervous.
Sure. Okay.
Yeah.
Look, I think you did well overall. So.
Okay.
But you're obviously pretty anxious.
Yeah.
Look, let's go through some of the aspects here. I didn't see you consent the patient, but you told me that you had done that, and he obviously was well prepared for the procedure. What about skin prep? How do you think you went there?
I think that went okay.
Yep, that's
good.
good. And the drapes were good too. That was fine. Local anaesthetic?
I think it was okay. Yeah, it's similar to some of the more minor procedures that I've done before.
Sure.
Yeah.
Just let me ask you about the time between giving the anaesthetic and actually starting the procedure.
Yeah. Maybe I should have waited a little bit longer.
Why do you say that?
I guess I didn't really do a check to see whether it was working.
No, you didn't. So it's always worth doing. You never quite know. Sometimes you don't get the anaesthetic in quite the right place, and it's always worthwhile just find needle and just seeing if it's sharp or dull, and where they can feel it. Okay. Incision and insertion of the needle.
Well, I was pretty happy with that.
And so was I. I think incision was good, and the needle. You look very anxious then.
Yeah, I mean, I was very worried that I might go in a bit too far.
Yep.
Yeah.
We all worry about that. Worry about going in and coming out the other side.
Yes.
And so one way of doing it is perhaps just holding the needle very tightly, and as you're going in, if it gives suddenly, you can only go in so far. It's worth remembering that.
Okay. That's a good idea.
All right. Now wrapping it up at the end. I think you were good when you explained to the patient that it was all over and that the fluid looked okay, but you were going to send off to pathology. You did that well. But what about the patient, involving the patient throughout most of the procedure?
Yeah, to begin with, I did get the informed consent, and I had a bit of a chat to the patient about what I was going to do during the procedure, and I also made sure that he was in a fairly comfortable position.
You did that well?
I guess I didn't really talk to the patient very much during the procedure. I was a bit nervous about it.
Yeah, hardly at all from my observation, I must say. So just put yourself in the patient's position. You're behind them, they can't see what's going on, so they're obviously probably more anxious than you were actually.
Yeah.
So think about those situations when you're actually going to do something that you yourself, if you were the patient, would start to feel, what's going on here, that sort of thing. So It's very important to keep talking to them all the time. It's the same when you're examining them from behind, you know, a physical examination, tapping their chest, feeling, prodding, whatever. Just always keep talking to them. Okay, but overall I thought very well. You're effective and certainly very safe. Okay. So let's just kind of recap.
All right.
I want you to tell me now what issues you're going to concentrate on next time you do this or a similar procedure.
Okay. Well, I guess firstly with the anaesthetic, just make sure I've given it enough time and that I've checked that it's working. Engage with the patient a bit more and definitely talk them through the procedure. And also with what you showed me with the needle and just holding it the way you showed me so that I don't have to worry about it going in too far.
Excellent, excellent. That's good.
Okay.
Excellent, fantastic.
Right. Thank you.
Here, have a cup of tea now.
Okay,
All right.
thank you.
That was good.